Your Excellency, Mr. President, we've been asked to speak about your achievements in the social sectors in 10 minutes or less. It will take more than 2 days to give the details of all that you have accomplished in the last 2 years. I would like to point out the SGF's remarks that you are the professor of infrastructure, but to correct it, that beyond physical infrastructure, Mr. President, you are also a professor of human capital infrastructure, the people of Nigeria, the gray matter of Nigeria. What we have been doing in health, education, women affairs, youth, and all the social sectors is to build an important pillar, which is the people of this country, which is the demographic dividend that this country has. I have a presentation which I will ask someone to quickly take us through to show what we have done in health, which is just one example, paralleled by what is being done in education, in other social sectors. Mr. President, this is where we were in 2023, with dilapidated infrastructure at the primary healthcare level, with high mortality, with drain of human resources. Next slide. Next, this is the compact, and Your Excellency, all the governors, I will remember when you oversaw the signing of a compact that brings federal government and states as well as local governments to work together to advance the health of the Nigerian people. And we accepted to improve governance, to ensure efficient and equitable service delivery, to unlock the healthcare value chain and improve health security for all Nigerians. And this signing was a landmark moment. Next slide. This is the scorecard. On a quarterly basis, Your Excellency, on the basis of your direction, we have quarterly performance reviews to assess how we are working together to improve the health outcomes for all Nigerians. Next slide. The policies of your administration, 21 important policies, have already been approved under your administration in the last 2 years, which have direct bearing to the health and well-being of all Nigerians. Mr. President, these policies range from those that are reproductive, maternal, newborn, and child health, the value chain, maternal health, the infrastructural management, food safety, and other arenas. Next slide. This is a representation of the more than 1,000 primary healthcare centers already revitalized by your administration in the last 2 years. And there are 5,500 in various stages of being revitalized all over Nigeria. The map shows the distribution of 8,800 primary healthcare centers by states, where the federal government, through the Basic Healthcare Provision Fund, on a quarterly basis, advances funds for drugs, for human resources, and for running of those primary healthcare centers. And Your Excellency, this is a major contribution that is only made possible by the collaboration with all the 36 state governors who are here today with us. And I'm pleased to say that 37 million visits to Nigeria's primary healthcare system supported by the federal government occurred in the first quarter of 2025, which means at that rate, we'll expect about 140 visits, multiple visits by individuals, which is further higher than the less than 10 million visits per quarter before your administration. This is an important milestone that shows Nigerians are beginning to tangibly enjoy the improvement in service delivery.